Thank you very much, Dr. Iskandar, for your kind introduction. And I'm very humble, and it's my great pleasure to be part of this symposium. And I would like to express my gratitude to the organizer for giving me this opportunity to be part of this exciting meeting. So my today's presentation will be focusing on the role of the community-led service delivery on retention in care. And I would like to declare that I'm not the clinician. I don't have any medical backgrounds, but my passion to share this presentation with you is actually coming from the pride of the community. That's where the key populations have been strengthened their capacity to be part of the healthcare system, especially when it comes to HIV treatment and care. And here's the outlines of my talk. I will share with you about the background from an implementation study on the community-led same-day antiviral treatment, or same-day ART. I know that we were discussing on this a lot this morning, but my data that to be shared with you today is about how the same-day ART has been brought to the community-led clinics in Thailand. And I will share with you about the methods, results, and I will end my presentation with a few key takeaway messages. So in terms of background, same-day ART or same-day antiretroviral therapy initiation has been actually included in the Thailand's national guideline on HIV treatment since 2020. However, 20% of men who have sex with men and transgender women who were diagnosed with HIV into community-based organizations or at CBOs in Bangkok, they experienced pre-antiretroviral therapy attrition. And to bridge this gap, we pioneered the community-led same-day ART initiation hubs, and this analysis actually evaluated the HIV cascade outcome from the ART initiation to viral load suppression. In terms of the methods of this study, it's an implementation effectiveness trial being conducted at two community-based organizations. The first organization is SWING, the Service Worker in Group Foundation, which there is a sex worker-led community clinics based in Bangkok. And another one is the Rainbow Sky Association, or RSAT, which is led by a community of MSM and transgender women. And the implementation strategies for this study were pre-identified, including developing multi-stakeholders partnerships, adapting same-day ART to CBO's context. We also conducted trainings, key populations, lay providers who have been the important part of this system and for these studies. And we also using evaluative and iterative strategies. In terms of participants, the participants for this study who were eligible for the community-led same-day ART, they have to be at 13 years old or above, HIV positive, ART naive, and willing and clinically eligible. We have to also conduct training in order to make sure that the key population lay providers will be able to provide appropriate services for the same-day ART initiation at the community-led clinics. This also includes the lay providers-led counseling, laboratory testing, opportunistic infection screening, and ART dispensing under the physician supervision, primarily via the telehealth platform. And next, participants were followed up at 2 to 4 weeks after the initiation, and then they would be referred to their long-term ART maintenance facility, and supported will be provided for 12 months by the key population lay providers at the clinic as well. In terms of additional implementation strategies that we are using, these also include care coordination between different providers, and we also assisted our participants with the health scheme transfer and navigation. It has been enacted to enhance the HIV outcomes. In terms of the results, so between 8 October 2021 and end of March 2023, we have enrolled 587 individuals into this study. And the median age of the participant in this study was 25 years old. 72% of them, they were men who have sex with men. 7% they were transgender women. And the rest are cisgender women and men, cisgender men who identify themselves as the bisexual men. And the median CD4 count was 384. On your left-hand side, you can see the charts or the graph that's showing the HIV cascade. So we found that 587% of them, 87 of them, they're logistically eligible for same-day ART. And 100% they were offered same-day ART on the same day of the HIV diagnosis. And all of them, they actually agree to accept or to initiate the ART and also have undergone the OI screening. And after being clinically assessed, we found that 585 of them, they were clinically eligible. And on your far right, you can see that it's around 481 of them, they successfully initiated ART on the same day of the diagnosis. And around 10% they actually initiated the ART on the second or on the third day due to some logistically barriers. And we have also seen 12 participants who did not start ART. They were referred to the hospitals for clinical investigations, which including for suspected tuberculosis, cryptococcal meningitis, and pneumocystic pneumonia. And among the community-led same-day ART participants who reached month 6 and month 12, 80% of them and almost 85% of them, they remain in care respectively. Of 210 participants who tested viral load, 94% of them, they had viral load suppression. And in addition to that, 97%, 98, and 96 of the participants, they were satisfied with the community-led same-day ART service, key population lay providers or the healthcare staff, as well as the clinic facility respectively. We also conducted a key informants interview from the participants as well as from the key population lay providers. And we found that in terms of the participant point of view, they were very happy to be able to access to the antiretroviral treatment immediately. And from the community lay provider perspective, I think it's something that's we found that is something about pride and the ability to bring the service closer to the community, and they're really proud to be able to serve their own community members as well. So in conclusion, we found that under this study, task shifting or task sharing ART initiation to train and certify key populations lay providers, in this case it's men who have sex with men, transgender women, and sex workers, can promptly link key populations to care with high retention and viral load suppression. And lastly, community-led same-day ART should be scaled up nationally in order to accelerate an end to the AIDS epidemic in Thailand. Thank you very much for listening, and that's the end of my presentation.